Good morning, everyone, and welcome to the First Nations Housing Community Webinar Series. Today we have Siva Apia from Indigenous Services Canada and Amy Montgomery from First Nations and Inuit Health Branch here to talk about current hot topics in First Nations housing. First, we would like to know where everyone is joining us from. Let us know in the chat at the bottom of your screen. If you have any questions during the webinar, we will have a Q&A session at the end of the presentation. Please put your questions in the Q&A box, not the chat, and we will do our best to get to everyone during the session. This webinar will also be recorded and uploaded to our website shortly after the session. Thank you for joining this morning. Wow, looks like we've got quite a variety on here. We've got people from Fort Frances, Garden River, Winnipeg, Woodstock, Chapleau Cree, Chippewas of the Thames, Webequay. Good morning, everybody. Thank you so much for joining us. Now I'll let Siva take it away.
Okay, so good morning again. My name is Siva Apia. I work at Indigenous Services Canada, Ontario region as the regional lead for housing and file. The presentation today is for general information purposes only. If you have any specific questions, I will be happy to discuss them at the end of the presentation, or you can contact me directly after the session. With the limited time allotted for this session today, I will now proceed to the next slide. So today I would like to discuss some of the topics mentioned in the introduction. Again, since the time is limited, I may be skipping through some of the information. As you can see on the outline, I will talk about COVID-19 restrictions in the work we do, and I'll briefly touch on how ISC, Indigenous Services Canada, Ontario region, support housing on reserve. I will review some of the significant investments made since 2016-2017. I will provide some summary points on the national housing and related infrastructure strategy. I will review some of the housing types we supported in the past. Then I would like to hear from you about some of the trends and innovation you see in your communities that could be replicated in other communities in Ontario and nationally. I will end the session with some summary points on ministerial loan guarantee as well. As you know, we are all living and working differently now under the COVID-19 situation. Since March 13, 2020, most of our offices are now only open for essential services only. Travel to First Nation communities is restricted to extremely essential services only. Slowly but surely, all ISC staff are now equipped with working from home. The staff are available as they were before COVID-19 during the normal business hours. You may contact them by phone, email, or use Microsoft Teams and WebEx for virtual meetings. Now, how do we support housing on reserve? We have a number of programs to support housing on reserve. First, we can look at the Capital Facilities and Management Program. Under this program, the funding is set aside every year at the beginning of the fiscal year and distributed to all Ontario First Nations using a formula which takes into account the population, geographical location, and the available budget. This is normally known as the minor capital allocation. First Nation Chief and Council is encouraged to use the flexibilities under the 1996 housing policy and prioritize this funding to meet their needs in the community. Approximately, we spend 23 to 25 million annually to support this program. I will skip the ministerial loan guarantee for now, as I have another slide at the end of this presentation to talk more about the ministerial loan guarantee program. Similarly, I will skip the targeted funding program because I have another slide towards the end of this presentation to talk more about the targeted funding program. The next one is the shelter allowance through the Ontario Works. In Ontario, we have something called a provincial comparability in delivering Ontario Works to First Nation members living on reserve. Indigenous Services Canada has an agreement with Ministry of Children, Community and Social Services. This is known as the 1965 Canada-Ontario Indian Welfare Services Agreement. Persons who qualify under the Ontario Works program will also qualify for shelter allowance to assist them in paying for their shelter charges, whether it's rent or mortgage. We also support chief and council through emergency management program. When houses are damaged due to natural disaster, the program can help to cover the repair cost of these homes to the original condition. Okay, so total investments since 2016, over the 2 years, 2016-17 and 2017-18, there was an investment of $416 million nationally. In Ontario, that turned out to be $102 million. What did we use this money for? We invested in building new homes, renovating existing homes, and building capacity. And in 2018-19, there was an additional $200 million, which came out of the budget 2017 announcement. And Ontario region received approximately $38 million of that. Again, the money was invested in building new homes, renovating existing homes, and building capacity. Altogether, within the 3 years, we were able to support the construction of 600 new homes, 725 renovations, and 183 capacity building projects. In 2019-20, because the budget 2017 was a 3-year commitment, 2019-20 was the second year of the budget 2017 commitment, which also brought in approximately $200 million nationally, which turned to be about $28 million in Ontario region. And we invested that into the same categories as previous years, which is construction, renovation, and capacity building. But the distribution of these funds were slightly different. Starting from 2019-2020, we used a different allocation methodology, which is the formula-based allocation. Similar to the minor capital allocation, we flow this money using the enhanced formula allocation to every First Nation in Ontario. In the same year, 2019-2020, we also allocated an additional $25 million. This came out of the Human Rights Tribunal decision, where housing monies allocated to housing can no longer be moved to other asset categories. So housing program was able to gain this $25 million in 1920, and we used the same methodology to allocate these funds to the First Nation. In 2020-21, which is the final year of the budget 2017 commitment, the third year, we received the same amount, $28.6 million, as well as the additional $25 million from the Human Rights Tribunal decision, which brings us to adding more money to building new homes, renovating existing homes, and building capacity. As you can see, starting with 2019-2020, the allocation methodology has been consistent, which is using enhanced formula allocation, letting the First Nations to decide how they want to spend that money or prioritize that money for their housing needs. So this has been the total investments to date since 2016. I'll now move to this next slide. Can you see the slide number 6 now?
Yes, we can.
Okay, thank you. So now we are looking at future investments. What is ahead of us in the coming year, which is 2011-2012 fiscal year? Because the budget 2017 commitment has ending or hasn't, yeah, it will be ending by March 31st, 2021. We no longer have a targeted programming until we get new directions from the government. So that new direction will come or start with the throne speech, which is expected sometime in February or March. If money is announced in the throne speech, the department will then be required to do a Treasury Board submission to access that funding. The Treasury Board submission will include the distribution method, the terms and conditions, all the accountabilities that needs to be incorporated in order to spend that money. After the Treasury Board submission, then we need to go to the cabinet. So there'll be a memorandum to cabinet. And after the cabinet approval, we'll get the budget lines, which will give us the spending authority at the regional level. And then the Ontario region and every other region across the country will be entering into a funding agreement with the First Nation. After the funding agreement is signed, then the First Nation will be required to report back on those spendings, on those investments, which will be reported back to Treasury Board as a complete cycle. As you can see, if you were to expect any additional dollars, it will take some time after the throne speech. So we are not expecting any new dollars to come to the regions, probably at least after the summer of this year. That's not to say there is no funding available for housing. Our annual minor capital allocation will continue to be flowing through the funding agreement. And we will also have the $25 million afforded to us through the Human Rights Tribunal decision. So there will still be funding available, but it will be at a reduced rate. What we would recommend First Nations is to be ready for any new investments. So the existing funding could be used to continue on with the projects that you have already started, or to prepare for any new funding. So building capacity, building your plans, selecting your lots, or whatever it happens to be. But if funding becomes available through the throne speech, it'll be a short year between late summer and end of the fiscal year to spend that money. So we want the First Nations to be available or shovel ready to accept and spend that money in a short period of time. Now we are moving to the next next item on the agenda, which is the 10-year First Nations National Housing and Related Infrastructure Strategy. First, I want to thank CMHC, Canada Mortgage and Housing Corporation, for sharing this slide with me. And again, this is for information purposes only. Some of the information here may be outdated now because there has been additional investments under the strategy. But anyways, for information purposes, this slide is still good. As you know, the government had committed to doing a housing strategy nationally that includes on and off reserve. After the National Housing Strategy consultations in 2016-2017, there was a decision to move forward with the National Housing Strategy, which was led by Canada Mortgage and Housing Corporation and has now been completed, and investments are being made through that National Housing Strategy. So to date, again, this number may be outdated a little bit. Approximately $40 billion have been invested over a 10-year period through that National Housing Strategy initiatives. Then there was a need to have distinction-based housing strategies for First Nations, Inuit, and Métis. And that housing strategies are based on self-determination, reconciliation, respect, and cooperation. So if you move over to your right, under the indigenous housing strategies, there was 3 separate strategies for First Nations, Inuit, and Métis. Indigenous Services Canada, along with AFN, is taking the lead on developing the First Nations strategy. Inuit and Métis strategy has now been completed, and over a 10-year period, there's been some funding commitments for those 2 strategies, $640 million over 10 years for the Inuit strategy, $500 million over 10 years for the Métis strategy. The First Nations strategy was an interim strategy. There was commitment under budget 2016 for 2 years. That was the $416 million. And then there was commitment under budget 2017 over a 3-year period for a total of $6 million. This strategy is still not finalized, and AFN is taking the lead on it, and we are hoping to see some results in the very near future. Some more information on the 10-year First Nations housing strategy. It is, again, to improve housing conditions for First Nations and to ensure all First Nations have access to safe, secure, adequate, and affordable housing. It is being led by Assembly of First Nations and co-developed with Indigenous Services Canada and Canada Mortgage and Housing Corporation. The strategy was submitted to national chiefs by AFN in 2018, and it was endorsed by national chiefs. The principles of the strategy is, again, self-determination, reconciliation, respect, and cooperation and partnership. So after the strategy was endorsed by the national chief, AFN and Indigenous Services Canada and CMHC are working on an implementation plan, which is currently under development. The end result of the strategy is expected to be the transfer of care, control, and management of housing by First Nations for First Nation. In order to do the costing model for this strategy, AFN has completed a data collection initiative, which I'm really glad about, 81% response rate in Ontario. However, nationally, the response rate was 60%. Again, this number may be a bit outdated. I know they are continuing to receive the surveys back. Again, if First Nations have not completed the AFN data collection survey, it is strongly encouraged, and it was encouraged by Chiefs of Ontario as well to complete those surveys and towards 100% completion rate. AFN has also tabled a technical report based on the data collected to date and a costing model to national chiefs at the last assembly. Any questions or comments, or if you need additional information, I would recommend that you contact the representatives at the AFN. There are 2 people from Ontario sitting at the table, a representative from Chiefs of Ontario and a representative from FNHC are sitting at the national table for this strategy. Okay, next topic on the agenda is continuum of housing for various demographics. There has been questions about what type of housing that we support for First Nations on reserve. So the type of houses that we supported is detached family homes, multi-unit dwellings, homes for seniors, independent living, and tiny homes. Again, as long as it is considered a principal resident, we work with the First Nation to support any kind of housing needs that they bring to us within the funding envelope that they get. Emerging trends and innovative housing projects. I'm hoping to get some feedback from the participants on this as we plan for the next fiscal year and forward. If you have any trends and innovations that you would like us to continue to look into or to introduce to our programming, please let us know. You can let us know through the evaluation of this session, or you can send them to me directly at the end. Ministerial loan guarantee. We support ministerial loan guarantees for First Nations when they need to access borrowed funding in order to address housing on reserve. Most financial institutions will not take the risk of providing a housing loan on reserve unless there is a guarantee of payment in the case of a default. I'm going to skip through some of these details because of the timing. We do have currently about 4,810 housing units supported by Ministerial Loan Guarantee Program, and there is about 723 agreements with First Nations in Ontario. Just wanted to highlight that for First Nations who are not using the Ministerial Loan Guarantee Program, it is highly encouraged that they talk to us and they look into the possibility of using the Ministerial Loan Guarantee Program in order to support housing on reserve. There is about $327 million liability that we are carrying on behalf of the First Nations in order to support the on reserve housing. Here are some of the sample housing that we did in the past few years. The first one here is the Six Nations of the Grand River First Nation. For the first time, they have implemented a tiny homes project, 8 units completed in August 2020. This is a project completed in December with Sushik Onigam First Nation. This is a project at Mississauga of the Mississaugas of the Credit First Nation, completed in August 2019. This was actually for elders, it's a duplex unit. It was quite successful that they'll be doing another one of the same on the other side of the lot. And again, another multi-unit project for the first time, Chippewas of the Thames First Nation, completed in July. Muncie has completed the exact same type of housing in their First Nation for the first time for multi-unit housing in their community. This is a project completed at Beausoleil First Nation. It's a 6-unit project. You see 3 units on this side, 3 units on the other side. They are varying in size. As you can see, it's a somewhat of a complicated design, but it accommodates all type of families and individuals. This is a project completed at Saugeen First Nation for single parents, small units, affordable units, high efficiency units. This is the design that they came up with in order to support the target group that they were trying to address. Another project at Ganugaming First Nation completed in August 2018, and a project completed at Wikimakong Unceded Indian Reserve in July 2017 is a 6-unit project. Again, this was quite innovative. Energy efficiency, smaller units in order to support transitional housing for the first time occupants. My contact information is there. I also have Sandra Liu work with me. She takes care of Ministerial Loan Guarantee Program with me. If you have any questions about the Ministerial Loan Guarantee Program, I would recommend you contact Sandra first and then me. If you have any other questions on any other housing projects in Ontario, my contact information is there. That is the end of my presentation. Thank you. I think we have Amy from First Nations Inuit Health Branch who will take over from here.
Okay, can you guys hear me okay?
Yeah, I
Yes,
can
we
hear you.
can. Thanks, Amy.
Perfect. So good morning, everyone. My name is Amy Montgomery, and I am the Senior Environmental Public Health Officer for the Thunder Bay area. Today, I'm going to talk to you a bit about housing and environmental public health programming. We're going to look at what we do in our housing program. We have environmental health officers, so I'll talk a little bit about that. And then I'll talk a bit about how we've adapted program delivery to meet the needs of your communities during this pandemic. So the objective of our program, and this manual may be familiar to a lot of you. I had a look at some of the attendees. I see a lot of familiar faces. So hello to everyone, and hello to anyone I haven't met previously at the housing conference. If you don't have a copy of this manual, you can certainly contact your community environmental health officer or myself, and we can make sure you have this. So essentially it just details our program. It talks about the work that we do and how it identifies and prevents risks that could negatively impact the health of your community, whether that's an individual or multiple people. So the guiding principles of our program, which are very important to ensure success, and that's working with your communities as active partners, collaborating not only with your community, but other First Nation organizations, other provincial and local health authorities, and other departments and agencies that are responsible for environmental health programming. We also strive for a level of on-reserve environmental public health service that is comparable to off-reserve. So just to put it in context, we are in Ontario. So I see there was some people from Winnipeg and from other provinces. So within Ontario, we have public health units that provide environmental and public health services off-reserve. So they would be your health inspectors, and it's probably very similar in other provinces in Ontario. And then as environmental public health inspectors, we provide services to on-reserve clients only. So we don't have authority, it's different. So again, these guiding principles are very important that we work with the communities and with, focus on your priorities. I know quite a few people on the line are probably familiar with the role of environmental public health officers. We used to be called EHOs previously. I've been called Water Girl. That's one of our big programs. So a lot of people are very familiar with the water program that we do, but we also do offer this program, which is housing. So we gather data by conducting inspections and investigations, and we look at that data and we try to work with the community and promote public health that is specific to the needs of that community. I'm personally employed by Indigenous Services Canada, formerly Health Canada, but FNHC has moved under this organization. There are also environmental public health officers that are devolved, so they work for First Nation organizations, and we do have a few devolved organizations in Ontario. Regardless, all environmental public health officers must be certified as a Canadian Institute of Public Health Inspectors. Oops. So the core programming, these are the 8 programs that we're a part of. Definitely number 8 and number 7 are standing out a lot right now. Our department is working under our business continuity planning because we are dealing with the public health emergency. So today I'm going to talk to you a bit about health and housing. So this is from that manual I talked about. That's just sort of a brief overview of what our program is. It talks about this specific program and what our activities are. So there's 3 main activities that fall under that. One of them is public health assessment. So that might be an actual inspection of a facility, whether it's a house or a school, a band office. We also will review plans from a public health perspective. So when we talk about housing, we're often talking about sewage systems that are decentralized, not connected to your community system. So you may have septic systems that are put in. So those are things that we would work with you to review the plans and provide advice and guidance. We also provide public education to the community, to the administration, to chiefs and councils, and with that education, of course, any training sessions that we can offer that would meet your needs, we're happy to do that. So the big thing I think everyone has been going through is adapting program delivery and how you run programs or administer programs even within your own community. Siva mentioned that most Indigenous Service Canada staff are not working from the office. And people are, because we're under the business continuity plan and also required to follow the workplace environmental and occupational health and safety requirements. So today I'm in our office, there's 3 people, the heat's turned down, it's really cold. So I'm trying not to shiver while I talk to you, but you know, again, we're all adapting and we're all trying to do our best to keep things moving forward and improving health. So one of the big things, obviously, and it's going to be specific to every community, is your community's requirements for restrictions and access. So we have to be very aware of the requirements, not only of the province and their restrictions, but we also need to communicate directly with your leadership to determine what requirements are in place in your community. Are we able to attend, for example, if we have a request for a housing inspection? What is required to enter the community? Is it screening? Is it PPE? Maybe they don't allow anyone in. So those are things that we're working through with each request that we get. There was a environmental public health officer safety guidance developed nationally, and I believe they did this with almost all of their health professionals. So for example, nurses would have safety guidance that they have to follow when they're working in your community. You know, not only is the health and safety of our staff important, but we certainly don't want to be in a situation where we put your community at risk by entering and possibly spreading. So again, the guidance is going to be updated kind of as the situation evolves and as best practice change. So we have a picture of PPE there. I have mine here. If I'm in the office, I have to wear it. I'm okay with the door closed and I'm giving a presentation. So thankfully I'm allowed to take it off and smile at you today. But you may see, if you invite an EHO in your community and we have approval to attend within your requirements and restrictions, you will see us donned in more personal protective equipment than normal. We may have different types of masks on. We may have like a white bodysuit on, and that's for the protection of you, the client. So for example, if we're doing a daycare or school, we may have enhanced personal protective equipment on so that we are not possibly spreading the virus back or forth in that type of environment. Just trying to be on top of my time here. So another thing that we ensure is the safety of our coworkers and community members. So before we come in, we're going to contact somebody that can advise us whether we're able to come in, and we're going to talk and have a plan. So if we come to the community, we're not just kind of poking around, knocking on doors. We want to ensure that we know who we're meeting with. You're aware of you're going to have your PPE on. I'm going to have my PPE on, and we're going to try to work together in a manner that's as safe as possible. And again, we do that directive for self-screening. So I would do that every day for work, just like our kids would if they're attending school. A big part of adapting has been looking at how to communicate to our clients. So we've really had, obviously, in a lot of cases, had to go to virtual when possible. We have had EHOs conduct inspections and assessments virtually, and we'll do that any way that works for you. You know, Skype's kind of old, but maybe you like Facebook Messenger or Facebook video. Maybe we could FaceTime. Any way that we can virtually go with you and assess the home, we will, so that we don't have to attend, or if we're not able to attend due to restrictions. We do have ongoing participation with community and individual water and wastewater project teams. So water is a huge component of public and community safety. So that's something that is ongoing. Project teams are still moving forward and meeting and you know, discussing long-term boil water advisories and upgrades and all of those things. So these projects are still going on, but often they may just be done in a different delivery method, or the meetings may be done differently. We've had a lot of virtual training sessions and meetings. Another example of ways we've adapted, you know, sometimes we would have insects shipped to us, or we would pick them up on our next visit. If you have insects in a home you want assessed, well, now we would just go photo or video, anything we can do to kind of get that information flipped back to you as soon as possible. I did want to bring up there is a new resource for indoor ventilation in homes that was just updated on the 18th. So I kind of pulled some information from there. And this is available online. If you just Google this title, COVID-19 guidance, you'll be able to find this document, or alternatively email me and I can flip it to you. So this document was developed by Public Health Agency of Canada. It talks about indoor air ventilation and how we can reduce the spread of COVID. It provides very practical tips on how to improve indoor air and filtration. And the guidance is intended generally to be used across most indoor environments. But of course, you know, if occupancy or the type of building or activity, that may change the risk within that indoor setting. There we go. So one of the main key messages, and I think we're all very aware of this message, is that the virus is spread through droplets and aerosols, and it's the risk increases, and we're aware of this because we know there's social distancing messaging been going on for months and months. People that are in enclosed spaces or in situations where you're in close proximity to someone will increase your risk. So they say, yes, there's things that we can do in our ventilation in our homes. We can do things to improve ventilation, but the best way to prevent that risk of COVID to your community members is those preventative measures that we are having right now. So, you know, maintaining physical distancing, staying in our bubbles, practicing hand hygiene and good respiratory hygiene. So they do always go back that, yes, it's good to improve ventilation. However, we have to have these preventative measures in place. So preventative measures plus your adequate ventilation will reduce the risk. I'm just going to go through a few of these quickly. They are, you know, more recommendations for how to improve indoor ventilation within the home. Again, if you're in an enclosed space, a crowded place, or somewhere where you have to have close interactions with somebody, then you are now at a higher risk. Now, if you are working with someone in your office, in your housing office, and they love to sing and start singing, then your risk is greater. So things such as singing or shouting or working out, or anything that can expel those viruses a little differently can increase your risk. So for indoor gatherings, we know right now Ontario is under a state of emergency. They're telling us to stay within our own households. But again, you know, indoor gatherings, anytime someone comes in your home, you're just increasing the risk that you bring in the virus. So you always want to maintain the physical distance, and you want to wear these masks, which isn't fun. But again, it's a small measure that we can take to protect those people that we love within our homes. It's really important, especially, you know, to take these measures when there's an elder or another person that is specifically vulnerable to the virus. The difficulty is not everybody who's vulnerable has obvious things that cause them to be immunocompromised. So just because someone looks healthy and is young, we don't know their history. We don't know their vulnerability to this virus. So we have to assume that everyone is vulnerable. High-risk activities, I talked, if you're a big singer, someone speaks loudly, you have a room where everyone exercises together, we've been made aware that this is an increased risk. So crowding, I know, is obviously a concern that a lot of people in First Nation communities are dealing with, and it's not something that can be solved immediately. But these guidelines are here just to help you in other ways that we can improve ventilation. So we know the more people in a space, the higher your risk. And we do have situations in communities where we have multi-generational households or overcrowded households. And right now, we may not have an option to reduce how many people are in those homes. So what can we do? Ventilation, improving ventilation is a key component to good indoor air quality. Again, it doesn't protect you from the virus, but it's going to improve the situation and lower the risk. So they talk about very simple things that you can do. You know, when visitors come in, you're wearing masks, care workers, someone from outside a bubble. You want to try, it's difficult this time of year with winter, but again, if it's for a short period of time, if it can reduce the risk to an elder in your family or in one of the homes, maybe you could open up a couple windows on either side of the home so you get that cross flow that increases airflow. Another thing that people can do to improve the air quality continuously is running your bathroom and kitchen fans. And we talk about this all the time with preventing mold growth. So this is another benefit to recommending this, is that people run it as much as they can to draw that contaminated air outside. Another simple suggestion, if you have visitors over and you can't help it, is just putting a box fan in your window and trying to get the airflow to move quicker. People have talked a little bit about this guide that you can access has a lot more detailed information. And at the end of the guide, they refer to a lot of the documents that they have used to develop this. So if you are interested, and I know a lot of housing people on the call have a lot more technical knowledge than I do about how to run an HVAC system. However, you're always consulting operational manuals and making sure that they're operating effectively, they're maintained properly, they're installed correctly. One thing they do talk about is that you can utilize, if you have a forced air system, you can always switch your fan to on all the time, as opposed to just leaving it on when the heat comes. So that's another way to have the air constantly circulating if you're going to have a visitor in the home, because you have to. And then another thing that they talk about, which is really important, and I want to note today, because it's another thing that we always recommend to prevent mold growth, is the use of that heat recovery ventilator. If you can encourage people to run their HRVs, it is going to drastically increase their ventilation and drastically drastically improve air quality within that home. Now, I'm not going to go into detail, but I've had calls from people who want to know about portable air cleaners, air purifiers, chemical disinfectant, automatic spray systems. There's like ultraviolet light systems that kill COVID. The only thing I'm going to suggest is most of these are huge investments. So if you are considering any type of device, I'm going to show you where you can go so that you can make sure that it's safe. There's no evidence to support that any type of air cleaner or air purifier are going to reduce the effects of or the spread of COVID. So a lot of people are buying these. They're good. They increase air quality in your home. But if you're doing it just to remove the COVID virus, that may not be in your home anyway if no one's sick. So again, you want to make sure, is there value in buying this? Is the cost worth it? And is it an approved device? So here's the website that you can access, and this has authorized medical devices related to COVID-19. So I'll give you an example. I think we had a school that was looking at some type of ultraviolet light system that they wanted to install. And so there's a lot of pros and cons with those systems. Like they can be an occupational hazard for the people in the classroom if they have, if the lights get to their eyes. If you're spraying chemicals, that could have its own issues. So ensure that it's under this list if you're buying it for COVID-19. And if it's not, then you know that it's not effective. And again, is it worth the investment for your community to buy a giant system that may not in the end actually reduce the risk to the individuals? The other thing I wanted to bring up is we know COVID can live on a surface from a few hours to up to days. So just ensuring that any chemical, disinfectants or hand sanitizers that you're using in the community, you can go and check that it's on this list. And you've seen there's been recalls for hand sanitizer and stuff like that they found out don't work, they're fakes. So ensure you check out these lists so that you are investing in good products, or you can return something that was sold to you with, if it's not effective or not what you need. Humidity is the last thing I'm going to talk about. We again recommend you always keep your relative humidity, within the range as much as possible in your home. They do suggest low humidity can cause those droplets that come out of our mouth to shrink, and that they may stay in the air longer. But again, that's sort of a guess at this point. They don't know for sure, but we do know, high humidity can cause mold growth and cause more issues with indoor air quality. So I think ensuring that you work with the community members to try and always keep their humidity at a good level. There is a guidance for First Nations document. Unfortunately, it was just in draft this week, so I had a peek at it. They took a lot of the information from the document that I just went through. So it's not going to be much different than the information I shared today. It's just going to be more applicable to First Nations, hopefully more culturally appropriate. And I think it's geared more towards the community members. So you're able to share that with the community members. And then this type of document would be probably more applicable and useful to housing managers or people that are working in the communities. So once that is shared, today, I just wanted to take a minute to dedicate this presentation to my dear friend and former colleague, Dr. Thomas Dignan, who passed away last weekend. He worked with FNHC for many, many years, and I'm sure that some people on this event will recognize him. So he was definitely a mentor and somebody I respect greatly that dedicated his life to working with First Nations and public health. So I wanted to just take this opportunity to say goodbye and to thank him for everything. So again, any questions or concerns, feel free to email me. We have EHOs all over the province that provide service in Ontario. If you're out of the region of Ontario, I can still try and connect you with other offices in other provinces. So please reach out if you have any questions. And thank you, everyone. I don't know if I was looking at the right place during this during the presentation, but thank you all for attending.
All right, thanks, Amy. We'll go into our Q&A session. We have about 10 minutes, so we're probably not going to be able to get to everyone, but if not, I will try and connect with Amy and Siva and get answers to your questions posted on our website along with the webinar recording and their PowerPoints. So if you do have any questions, please put them in the Q&A, not the chat, and we'll get started. So I think this first question is for you, Siva. It's from Andrea Joseph. She says, I'm a homeless student. My reservation claims that there is no housing available. I've also sent priority letter and was told I'm ineligible. Any suggestions on finding out more information on programs that may help?
So most of the programming that we do are with the Chief and Council on a government-to-government basis. We don't have any programs to support individuals with their home, with their needs for resident. However, you know, depending on where you're located, if you're in Ontario or another region, I would recommend you give me a call directly so we can look at some of the local resources available in the region. I know there are some programs that, even though it's not managed and funded through us, but they do support people of reserve living in urban centers.
Great, thank you, Siva. I guess, Andrea, you can either email or contact us through the website and we'll connect you with Siva. And that way, we can get you his phone number and you guys can chat. Next, we have a question from Stan Higgins. I think this is again for Siva. Says, are the total investment since 2016 numbers a reflection of the money spent directly on housing, or do the numbers include administration costs?
So the numbers I presented here is the total amount of money transferred to First Nations. So a majority of that money goes directly into building or renovating homes or building capacity in the community. We do allow project management as one of the eligible categories for projects, but it's really depends on how the First Nation broke down their budget in building their homes or renovating their homes. But I can say from looking at a number of projects, I can say majority of the funding went directly into building or renovating homes or doing capacity building, not a whole lot in administration.
Thank you, Siva. Next question is from Shirley Thompson. Is the Human Rights Tribunal 25 million guaranteed every year? Clearly, to support human rights, more funding is necessary, and this money isn't going to make the total difference. Ongoing funding is needed.
I totally agree. The $25 million is expected to be continuous. I think we are on the second year of this investment. It is not new money that we received from any sources. It is an Indigenous Services Canada budget money. What happened is previously a portion of this housing investments were allocated to other priority areas like water or sewer or roads or bridges, or to building capacity, to building infrastructure in the communities. Now Indigenous Services Canada is no longer allowed to do it, even if there is priority access in other asset categories. This money allocated for housing will have to be spent on housing. So I do expect this money to continue at least into the near future, but future is to be seen. But I don't see this going away.
Thank you, Siva. Next question is from Peter, and I'm sorry if I get your last name wrong, Charbursky. And he asked, are foundation systems able to get funding?
Foundation systems are part of the housing construction. So any type of foundation that the First Nation determines is adequate and needed in their community, yes, we do cover the cost of the foundation as well as the servicing of the lots in the cost of building a house. It is an eligible cost.
Okay, I'm just going to get to some of Amy's questions. Panos Polisios, sorry if I got that wrong. Why do you suppose the CDC officially recommends the use of air purifiers to counter the spread of COVID-19, whereas they aren't officially recommended for use here in Canada?
Okay, well, I actually Googled that because I had a peek and I wasn't aware that they were recommending. So I pulled up some CDC info here. And again, like I know it's very frustrating and overwhelming for everybody since last year because things change so rapidly. So we find out information and then we have more scientific evidence and then it changes again. So it's hard even in this field to keep up with all of the changes. But I am looking here, like CDC does recommend running your HVAC system using an air purifier or portable air cleaner, but increasing ventilation are not enough to protect yourself and family from COVID. So again, they say that it's good to do. It'll improve your air quality, but that in itself will not prevent you from getting COVID in your home if somebody has COVID.
Okay, thank you, Amy. Another question that I think we're all wondering, this is from Mark McPherson, and he's asking, with the potential government change of leadership in the future, do you see the housing budgets changing or being removed from any funding possibilities?
I don't know how I can answer that question. You know, we work for the government and we get the mandate from the government of the day. So, I mean, in looking at historical factors, the housing support for First Nation has always been there, regardless of what kind of government comes into power. The level of support has gone up and down. So our minor capital allocation has pretty much remained the same. But under various governments, we had various targeted programs. We had Canada Economic Action Plan, we had Budget 2016, we had Budget 2017. So, I mean, I can point to the historical facts that there has always been support for housing, but in the level of support, we have to rely on the government directions and the mandates.
Thank you, Siva. I think this question is for Amy. You mentioned a manual, I think, in your presentation, and Frank French is asking if he could get a copy.
Yeah, Frank, that's not a problem. If you can email me directly, then I can send you that manual for the environmental health general program. And then you'll have access to the links, I believe, in the recording as well. I also just wanted to mention I believe it was a young lady that's having problems with housing. I'm not sure which area she's in, but I know a lot of the tribal councils sometimes have supports in place as well, or the First Nations health organizations that are connected with your communities. So sometimes they have advocacy groups they work with. So I would suggest you reach out to them as well.
And for reference, I've just put Amy's email address in the chat if you wanted to connect with her, Frank.
Thank you.
All right. Next question, or no, sorry, I guess we are just about out of time. So we will take the rest of your questions and we'll touch base with Amy and Siva and have those published on the website as soon as possible, along with the recording and the PowerPoints. So thank you again, Siva and Amy, for taking the time out of your day to join us. And that's a wrap for today, guys.
Thank you.
Thank you, everyone. I know it was my first time doing this online. Hopefully it went well, but I think majority of the participants that I see have known me or have access to me. So please do feel free to give me a call. I promise we'll do better next time.
You will.
You guys did good. Thank you.
Thanks, everybody.
All right, so thank you everyone for attending today's webinar. We want to hear from you about the topics you might want us to cover in future webinars, any ideas you have, success stories you would like to share, mistakes we can learn from, projects you've done, and more. So please visit our website or our Facebook page at facebook.com/FNHCOMM to share with us. We also have a survey that will open in the window right after this. We'd really appreciate your thoughts and feedback. We also have one more webinar left in this series, but that is still in the works, and we will be reaching out to let you know about that as soon as possible. Stay tuned to our website, firstnationshousingcommunity.com, and we'll be announcing further details about our annual conference and future webinars in the coming weeks. Subscribe online to be the first to know. Thanks again for joining us, and have a great day.